Hello everybody. Now we are going to talk about movement disorders. Disorders of movement lead to either extra unwanted movement like hyperkinetic disorders or too little movement like hypokinetic disorders. In either case, the lesion often localized to the basal ganglia. So in most of the causes of movement disorders due to basal ganglial disease. Although some tremor are related to the cerebellar or brainstem lesion, we have functional movement disorders which are common and may mimic all of the organic disorders. ممكن تشبهها. The most important hypokinetic disorders اللي راح نشوفها هو الباركنسون disease. ومن راح نشوف الباركنسون disease راح نلقي resting tremor, نلقي bradykinesia, rigidity, and other features of Parkinson's disease. While the history is important, observation is clearly vital in diagnosing movement disorders. We have many examples of movement disorders. The commonest movement disorder is a tremor. The types of tremor, we have cerebellar tremor, also we call it action tremor or intention tremor, essential tremor or familial tremor, Parkinsonian tremor, flapping tremor or asterexis, physiological tremor or fine tremor, and finally hysterical tremor. The other abnormal movement we could see in our clinical practice is chorea, commonly with athetosis and hemipalismus, so it's a chorioathetoid movement. We have dystonia, we may have dyskinesia, tics, myoclonus, epilepsy and convulsion, myokymia, cramp, and tetany. So those are the examples of movement disorders. And as I mentioned, that tremor is the most important cause of movement disorders. And how we define a tremor? It is an involuntary, rhythmic, regular or irregular, oscillatory distal movement with muscle contraction and relaxation. Can affect the hands, فعندنا tremor of the hands, arms, eyes, face, head, vocal cord, trunk, and even the legs. Most tremor occur in the hands, commonly in the hands, and exacerbated by stress. Any type of tremor will be exacerbated, will be increased by tremor, emotion, physical exhaustion. Tremor are divided into two types. Generally احنا نسميه resting tremor نشوف Parkinsonism, with action tremor or intention tremor نشوف cerebellar lesion. A very common tremor is the teeth chattering, which is induced by cold temperature or by fear. وصير عندنا كل هنا teeth chattering. The causes of a tremor, why patient develop tremor. Anxiety may cause tremor, senility, thyrotoxicosis, Parkinson's disease, as I mentioned, chronic renal failure. These are the diseases which can cause tremor. Chronic liver failure, stroke, multiple sclerosis, brainstem or cerebellar lesion, hypoglycemia, drugs such as amphetamines, cocaine, caffeine, steroid, and even SSRIs, selective serotonin reuptake inhibitors, or alcohol, or the withdrawal of a drug such as alcohol withdrawal or benzodiazepine withdrawal. Tremor can also be caused by lack of sleep, lack of vitamins, and increased stress. The most important type of tremor, or cerebellar or action or intention type of tremor, is a slow, broad tremor of the extremities that occur at the end of the movement, occur in the cerebellum, resulting from stroke, either in stroke in the cerebellum, or tumor or disease, also result from chronic alcoholism or overuse of some medications. The tremor is often most prominent when the affected person is active or is maintaining a particular posture. We have also titubation which is tremor of the head and is of a cerebellar origin. This is the way to examining for cerebellar lesion. This is a finger nose test, coordination, test for coordination, and as you can see here, the tremor very obviously, which is an action tremor in patients with cerebellar lesion. And sometimes you could see even titubation. This is titubation, head titubation and tamayul, head titubation in patients with cerebellar or brainstem lesion. This is head titubation. The other important types of tremor is essential tremor or a familial tremor, which is most common types of tremor. The commonest of familial tremor, although the tremor may be mild or non-progressive in some people, in others the tremor may be slowly progressive, starting on one side, then the other side is affected within 3 years. The hands are most often affected, but the head, voice, tongue, legs, trunk may also be involved. Other than hands affected in familial tremor. Severity may increase with age, so affecting person's ability to perform the certain tasks or activities of daily living. طبعا any type of tremor, emotion, stress, fever, physical exhaustion, or low blood sugar may increase the severity of tremor, essential tremor. Onset is most common after the age of 40, قسم 50. Although symptoms can appear at any age, essential tremor is not associated with any kind with any non-pathology. In some cases, physical therapy or change in lifestyle may improve symptoms. If the condition affects the patient's ability to perform a daily task and has a negative impact on the quality of life, هنا طبعا راح نعطي medications مثل beta blockers, benzodiazepine, carbonic anhydrase inhibitor, and etc. طبعا keeping in mind that beta blockers, especially in elderly, may lead to memory loss. Now they are using a deep brain stimulation, a device with deep brain stimulation or gamma knife in treatment of essential tremor.
This is an actual patient from Stanford Hospital with a history of familial essential tremor. As you can see here, with his arms straight out, held up in the air, the tremor is persistent, as seen better here when zoomed in. Patients with
بنفحص الفينجر نوز تيست
essential tremor demonstrating a normal finger-to-nose exam.
يعني مو مثل السيربيلر.
As you can see, the patient is being asked to pick multiple areas to reach his finger out and extend it almost fully.
This is the way to examining for tremor. هاي هي الطريقة نفحص التريمر. Extend the limb, the inflection of the limb. Ask him to drink something, for example, if he could drink or not.
Okay. You make a circle?
Then ask him to make a circle or write something. This is the way to examining for tremor. هنا طبعا اللي يشوفون الديفرنس before and after treatment by deep brain stimulation.
Is turned on.
Other patients have essential tremor and his device now is off.
How much trouble I have writing my name.
So it's difficult in writing.
You can see it's not going too well right now.
With essential tremor.
You certainly can see what the problem is. Hey, I got a jack out there. The J doesn't look too good, but now I'm going to turn the device on.
Now he's going to turn his device on. You show the difference. Treatment nowadays for tremor by deep brain stimulation. Remarkable changes after the make the device on for treatment of essential tremor.
Device is turned on.
Now my device is up